Okay, so what is your age? Categorized: under 18 years old, between 18 and 24, 25 and 34, 35 and 44, 45 and 54, 55 and 64, or above 64 years old. Okay, can you please specify your ethnicity? White, Hispanic or Latino, Black or African American, Native American or American Indian, Asian or other. Thank you. Okay, so what is your highest level of education? No schooling completed, some high school or diploma, high school graduate, professional, technical training, bachelor's degree, master's degree. Okay. What is your marital status? Single, never married, married or domestic partnership, widowed, separated, divorced. Okay, your employment status. Unemployed but looking for work, self-employed, out of work but looking for work, a student, homemaker, military, retired, unable to work. Have you ever been treated in A&E or the emergency room? Okay, as a child or as an adult? Okay, and can you give a reason to why? Okay. Okay. Again, have you ever been rushed into hospital in an ambulance? Okay. For a different reason. Okay. Thank you. Have you ever had an allergic reaction to food, a drug, an insect, or a substance? No. Do you carry any medication in case of an emergency, such as insulin, an inhaler, or an EpiPen? Okay. Do you wear any medical jewellery, like a bracelet? Okay. Have you ever received stitches? Have you taken a tetanus shot in the last year? Have you ever been admitted to hospital with, a stroke, childbirth, an accident for tests, observation, or psychiatric observation? Okay. Have you ever experienced a fracture or a sprain? Okay, and can I ask at what age? Okay. Have you ever been denied medical insurance? Okay. Do you need any help with mobility, hearing, or speaking, such as wheelchair or walking aid, hearing aid? Do you use sign language, lip read, braille? Okay. And do you suffer from any of these conditions? Heart disease, stroke, cancer, diabetes, asthma, high blood pressure, epilepsy, or high cholesterol? Okay. Are you currently on any medication or tablets? Okay, and what's that for? Okay. So, this is a bit about your lifestyle. Smoking status: never smoked, ex-smoker, current smoker. Okay. And when did you stop smoking? Okay, a long time ago. How many cigarettes a day do you say that you smoked? Okay. And what regular exercise do you take? Okay. So a little bit about family history. This includes immediate family, okay? So this is mum, dad, siblings and grandparents. Have either one of these family members suffered a heart attack? Okay. A stroke? Okay, and what is their relationship to you? Okay. Cancer? Okay. Diabetes? Okay, and their relation to you? Okay. High blood pressure? And anything else that you can think of? Okay, excellent. Okay, so this is for female patients only. Have you ever had a cervical smear? Okay, excellent. And where was this? Doctors. Okay. And what was the result? Okay, excellent. And are you using any contraception? And if so, what method are you using? Okay, excellent. Okay, moving on. Questions for everybody. Do you care for a vulnerable person, adult or a child? Okay, alcohol question. Do you drink alcohol? And how many units a week would you say you drink? Okay, excellent. How often do you have a drink containing alcohol? Never, monthly or less, 2 to 3 times a month, 2 to 3 times a week, 4 or more times a week. Okay. How many drinks containing alcohol do you have on a typical day when you are drinking? Okay, so how often during the last year have you found that you were not able to stop drinking once you started? Never, less than monthly, weekly, daily or almost daily. Okay. How often during the last year have you failed to do what was normally expected of you because of your drinking? Never, less than monthly, weekly, daily or almost daily. Has a relative or other friend or doctor or other health worker been concerned about your drinking or suggested you cut down? No. Yes, but not in the past year. Yes, during the past year. No. Okay, excellent. Okay. Has a doctor ever told you that you have a heart condition and recommended only medically supervised physical activity? Do you ever have chest pain brought on by physical activity? Have you experienced dizziness or lost consciousness? Have you ever taken prescription medication for blood pressure or a heart condition? Are you physically inactive? So less than 30 minutes of physical activity 3 days per week. Have you ever experienced pain or discomfort in the chest, neck, jaw, arm or other areas of your upper body? Okay. Do you currently have swelling of your ankles? Do you ever experience unusual fatigue or shortness of breath with usual daily activities? Okay. So I'm just going to go through a list of conditions, okay, health issues, health problems, and I just want you to tell me if you have either have them now, have had them in the past, or never had them, okay? And if you do have them now or have had them in the past, what treatment did or are you going through to treat the problem? Okay, so anemia, okay, arthritis, asthma, okay, and treatment. Okay, bleeding disorder. Oh, for goodness sake. Okay, blood pressure, high or low. Okay, bone or joint problems. Cancer. Liver disease. Okay, diabetes. Epilepsy or seizures. Okay, an eye disease or any sort of blindness. Okay, muscle pain. Okay, and treatment for that. Okay, glaucoma. Headaches. Okay, and treatment for that. Okay. Okay, that's fine. Head injury or brain tumour. Hearing problems, deafness. Heart disease. Any jaundice. Okay, any kidney disease. Lung disease. Oral health, dental. Okay. Stomach or bowel problems. Okay. Stroke. Thyroid. Tuberculosis. Okay. Learning problems. Speech problems. Anxiety. Bipolar disorder. Depression. Okay, eating disorder. And the last one, sleep disorder. No. Okay. Okay, last few questions here. Have you had any of the following symptoms in the last 60 days? Ankle swelling. Okay. Breathing difficulty. Chest pain. Confusion. Loss of consciousness. Okay. Coughing. Cramps. Dizziness. Falling. Hair change. Hearing loss. Lightheadedness. Okay, memory problems. Nervousness. numbness, panic attacks, seizures, shakiness. Okay, and the last one, vomiting. Okay, so just a few substance use and history. So, do you drink caffeine in any sort of way? Coffee, tea, pop? Okay, and what do you drink? Okay, and how many cups a day do you have? Okay. Smoking, I have asked you. Some questions do repeat. Okay, again, alcohol, I have asked you. Marijuana, so past use, current use. Okay, I don't need to put how much, no, it's just a tick. Okay, any sleep medication? Yep, so past use, current use, or no use. Tranquilizers. Okay. Any cocaine? And any heroin? Okay, excellent. That is the end of our health questions today. Okay, thank you for joining me and answering them honestly.